As lockdown measures are lifted, many parts of the world are feeling a sense of relief. In Wuhan, the original epicenter of the pandemic, there's been dancing in the streets to celebrate the worst being out of the way. In the Czech capital, Prague, locals have been returning to reopened pubs and restaurants. In Belgrade in Serbia, children are heading back to kindergartens and schools. And in Paris, traffic is returning once again to the Champs-Élysées. But as life gets back to normal, health officials are warning that a second wave of coronavirus is on the way.
Early serological studies reflect that a relatively low percentage of the population has antibodies to COVID-19, which means most of the population is still susceptible to the virus.
There is a precedent for multiple peaks in a pandemic. The second wave of the 1918 Spanish flu was more deadly than the first. With coronavirus, could the worst be yet to come? As nations continue to take tentative steps back towards normality, there's an ongoing danger that threatens to stop that progress in its tracks. Scientists say it's not a question of if there will be a second wave of coronavirus, but a question of when. As restrictions loosen, the opportunities for the virus to spread start to increase once more. A series of new infections in South Korea serve to show how fragile the recovery can be.
After a person infected with the coronavirus visited several Seoul night spots in early May, bars and clubs have shuttered, and about 120 people have been diagnosed positive for COVID-19, linked to the single case. The South Korean government only recently relaxed social distancing. Now this cluster outbreak, which started here in the entertainment district of Itaewon, highlights the struggle to balance the need to reopen the economy with the need to protect public health. Despite concerns the new infection can turn into a second wave, the government seems confident it can continue reopening.
Of course, it's not absolute, but as long as the number of daily confirmed cases remains below 50 and 95% of all infections are traceable by the government system, it can be manageable.
But the new coronavirus cases have reminded locals and visitors in Itaewon that protective measures are still needed.
The economy is doing badly. We're all very worried about the resurgence in virus cases, so individuals must follow social distancing rules.
When I went to the gym this morning, the gym said I have to wear the mask again to enter the gym, and this was the order from the government just yesterday after Itaewon's accident.
Individuals' credit card and phone data are used when required to track the spread of the virus. While there is the risk of privacy invasion, I don't think it's a tremendous problem.
Officials still seek out visitors to the Itaewon district using personal transaction, phone, and CCTV information, and tested 22,000 people. The hope is that continued aggressive contact tracing will let South Korea keep its successfully flattened curve.
Well, let's speak to Tobias Kurt, who is a professor of public health and epidemiology based here in Berlin. I'd just like to speak to you about a second wave. Are we definitely going to get one?
Well, thanks for the question. It's a question that is obviously discussed a lot. The virus is still there. So if we are releasing the measures, it doesn't mean the virus is gone. And if we know that over 90% of the population are still susceptible of getting the infection, likely far over 90%, that means that there will be clusters. Now, the question is, when are we talking about a wave? So it all depends on how we really attack this and how we react and how we are behaving ourselves and really taking care of the distance, of the hygiene measures that have been recommended since weeks now. So I think there is a chance of seeing a second wave, but if we all follow somewhat the rules, then this wave won't be a wave that is scaring us, hopefully.
And would we expect this to, like the first wave, to be a global wave all at once spreading everywhere, or will it be localised second waves?
Because everyone around the world is aware of this, and all the healthcare systems are aware of this. I think that we know now how to deal with an initial sign of a second wave starting. That means that we have to really address traveling, for example, so to reduce the mixture of people. And if you can take care of this and do this early enough, I think that a start of a second wave can be kept local.
And how will it compare to what we've already seen? Are we expecting a bigger second wave than the first wave?
These are speculations. I think that because everybody's aware of it, and if we are able to identify clusters, what we're trying to do in Germany, and tackle those who have been in contact with infected people and track them, then we will be able to really reduce the impact of a second wave.
And will the second wave of coronavirus be the same disease, or will it be slightly different?
The expectation is that it will still be the same disease. The virus may modify slightly, but overall it will cause the same symptoms and the same impact to people. So I expect that we see a similar way of disease spread as well as symptoms, and the potential hit of the healthcare system if people get severely sick. So there may be slight modifications, but we still have to understand a lot of what exactly the virus is doing and how this develops over time.
So is there a risk that we're going to have to live with the spectre of coronavirus hanging over us for a very long time?
Well, if you look a little bit into the past, this is not the first pandemic and it won't be the last pandemic. And we have to start maybe modifying somewhat our lifestyle to be ready for a next wave or a next virus that then leads to another pandemic. We have to maybe have slight modifications to deal a little bit with the hygiene measures. If we travel in airplanes or travel in trains, that certain things will be different. And we have to get used to this in a way that we are not in shock when a new wave actually reaches us, but really say, okay, here's a second wave, I know what we can do. And also we have to be a little bit smarter in terms of not locking everybody up at home, but really address the clusters that occur and really tackle these clusters and identify people who are infected and who potentially spread the virus.
So be prepared. Well, Tobias Kurt, thank you so much for bringing us your expertise. Professor of Public Health and Epidemiology based here in Berlin. Thanks for joining us.
My pleasure.
Well, now it's your chance to ask the questions. Our science correspondent, Derek Williams, stands ready and waiting to answer them.
What medical treatments do patients infected with the coronavirus receive?
One of the most frightening things about a pandemic involving a new pathogen is that when it starts to send people into hospitals, there's no specific medication immediately available to treat them. And that's still the case with COVID-19. No drug has yet been proven to be both safe and effective against the disease, although there are hundreds of clinical trials all over the world racing to test dozens of potential compounds. The antiviral remdesivir is farther along than any other. It's been authorized for emergency and compassionate use in some countries, even though investigations are still ongoing into how effective it really is. Until we have more information on it and other candidates, though, conventional critical care is all doctors have to help severely affected patients, using methods like mechanical ventilation, which are aimed at keeping you alive for long enough that your immune system can wipe out the disease on its own.
I heard the anti-parasitic drug ivermectin is being tested. Are there any preliminary results yet?
Ivermectin is a drug based on a compound made by microorganisms that break down organic matter in the soil. It's a very powerful tool in our pharmacological toolbox for getting rid of a wide range of nasty parasites, among them head lice. The researchers who discovered the class of substances it belongs to won the Nobel Prize for it a few years back. A little while ago, a research group in Australia looked at whether it would be effective against the coronavirus in cell assays, which is kind of counterintuitive when you think about it. I mean, after all, this stuff kills multicellular organisms like pinworms. Why should it be effective against a virus? But lo and behold, their results with the coronavirus were great. It looked incredibly effective. But there's a big problem, which is that the levels of ivermectin the researchers used to kill the SARS-CoV-2 were far higher than the authorities think would be safe to take. For now, the U.S. Food and Drug Administration has issued warnings not to take the compound for anything except what it was meant for, to treat an infestation with parasites, and to stick to the prescribed doses for that. Other studies with ivermectin are ongoing.
Can Truvada help protect people from COVID-19?
Truvada is the brand name of an antiviral drug combination developed in the fight against HIV. It's what's called a pre-exposure prophylaxis or a PrEP drug, which means you take it regularly in order to not get infected with HIV if you're exposed. So it's a preventative measure. It works by blocking an enzyme that HIV uses to reproduce. Could it do the same to the new coronavirus? It's unlikely. HIV and SARS-CoV-2 are very different viruses, and other HIV antivirals that have been tested didn't help people who had COVID-19. Still, a long-shot study with healthcare personnel is going forward with PrEP in Spain. Results from it are expected around the end of July.
Our science correspondent, Derek Williams there. If you do have a question, please do send it in. Now, if restrictions have meant you're missing going out to the restaurant for a lovely warm cooked meal, but you're still a little bit nervous about being surrounded by fellow diners, well, one restaurant reckons it has the solution. You'll have to travel out into the Swedish countryside for it. There, you'll find a highly exclusive table for one. The food is packed into a basket, and then it's sent flying down to you on a zip wire. There you see, it rules out all need for any contact at all, even eye contact. Getting a table can be tricky, though. They serve just one person a day. The Swedish couple who runs it says it's the smallest restaurant in the world.